Hi, I'm Dr. Chris English, and with me is Jen, my assistant. I'm going to be demonstrating for you how to put on a volar wrist splint for post-operative care of a patient. This is a splint that we often use for wrist fractures, and for quite a few other surgeries around the wrist. So these are the supplies that you need for this splint. One stack of 5x30 plaster, one or two 4-inch cast paddings, and one 4-inch ace wrap. So when you're putting this splint on, you typically want to have the wrist in just a neutral position. So we don't necessarily want it flexed forward or backwards, but just in a neutral position like this. When you're putting on the cast padding, I always like to start at the wrist. That way it doesn't come undone. And once I get it stabilized here at the wrist, then I'll go and go to the hand. I typically like to do 3 layers thick of the cast padding. So that's 1, 2, and 3. And one thing to think about when you're doing this is that the cast padding needs to go farther up than where your plaster is going to go. So there's 2 layers there, 3 layers there, and then I'm just going to overlap by thirds here as I come up to get it 3 layers thick all the way. And so even though on this side our plaster is going to stop about right here, I'm going to go plenty higher. That way I have plenty of cast padding around it. And so I always do 3 layers right on top of each other at the very end. So there's 1, 2, and we're going to have just enough to get the last layer, 3 layers. So that way right here at the edge, it's all the way 3 layers thick, so you don't end up with a very thin spot where you can get some, plaster pushing through. So plaster, when you dip it, take both ends into the water, keep the ends so you don't lose them, and then wring out the extra, open it back up, and then laminate the sheets together to get out any air. That way when it dries and cures, it gets firm. So what I'll do, you can take this and cut it so it's the right length. I like to usually just fold it. So what I'll do is I'm going to make it at this end the shape of Jen's hand by making a little area for the thumb and on the cascade of the fingers, and then the other end I'm going to fold up to make it the right length. So like I said, you can cut it or tear it before you wet it. Once you wet it, you can't really cut or tear it. So we'll bring this in here, line it up and make sure we have the right amount of space there. We can maybe fold this up a little higher. Okay, and this will usually just stay on once you get it in the right spot. And you smooth it around, it'll just stay on. So then I just go with the ace wrap. You can put some more cast padding to hold it on if you want to. So I don't typically necessarily do this, but in this situation, since I don't have an assistant holding anything for me, I'll put a little bit of cast padding just to keep it on. And then with my ace wrap, I cut a small slit in it for the thumb. Start with the Velcro piece on the back so it doesn't irritate. And when you're putting this on, you're not putting it on tight at all, just laying it on. You almost want to let some of the stretch come out of it that they put in when they roll these. So you want to let some of the stretch come out so it's just snug enough to stay on here. And so if you look, the plaster ends about right here. She can still close the fingers all the way. The thumb can move all the way. It's not impacting her thumb. And as this cures, we're just going to gently shape it to the shape of the palm and the wrist as it cures, which takes about 3 minutes. Okay, thank you.